Today, we're diving into one of the biggest puzzles in global public policy: Singapore's healthcare system. It's a system that gets these world class results, but somehow it seems to fly in the face of that ironclad rule that says top tier healthcare has to come with a jaw dropping price tag. This is a story of incredible design, some really tough choices, and constant evolution. So that brings us to the big question, right? The one we're going to unpack today. How did this tiny city-state, a place with zero natural resources, build a system that gives its people one of the highest life expectancies on Earth? We're talking 83 years on average, all while spending just a fraction of what other developed countries do. Folks, this is the Singapore paradox. And this chart, wow, it just lays the paradox out there in black and white. Back in 2016, Singapore was spending just over 4% of its GDP on health. Now look at the UK, almost 10%. And then you have the United States at a staggering 17%. These numbers tell you Singapore isn't just, trimming the budget here and there. They're playing a completely different game while getting elite results. The real question is, how on earth are they pulling it off? Okay, to really get to the bottom of this, we're going to go on what I'm calling an architect's journey. First, we're going to look at the philosophical blueprint that was the foundation for everything. Then we'll see the construction of its very unique financing pillars. After that, we'll put it through a stress test to see where the cracks started to show. And finally, we'll explore the massive renovation project they're doing right now to make sure the system is ready for the future. So here's our game plan. We'll kick things off with that core paradox, then dig deep into the philosophy behind it all. From there, we'll break down their 3M financing model, look at the challenges and pain points that cropped up, and wrap up with their big 3 Beyonds transformation strategy. It's the whole story from start to finish. All right, let's start at the very beginning, the blueprint. Because before a single law was passed or a hospital got built, there was this core guiding philosophy. And in Singapore, that philosophy is all about responsibility. Shared, yes, but starting with the individual. This quote from Singapore's founding father, Lee Kuan Yew, is everything. You see, as a young student in Britain, he saw the birth of the National Health Service. And at first, he was blown away by this cradle-to-grave safety net. But over time, he came to believe that a system like that, well, it could actually make people less motivated. And that single observation became the absolute cornerstone for Singapore's approach. They made a deliberate choice to not copy the Western welfare model. And they wrote it all down in this 1993 white paper, which became the official blueprint. What's so fascinating is the balancing act it performs. On one side, it's all about personal responsibility, using market competition. But on the other side, it makes it crystal clear that the government has a duty to make sure basic care is affordable for everyone, and crucially, to step in if the market starts to drive costs too high. So you've got the blueprint. Now it's time to build. And that philosophy of responsibility wasn't just a vague idea. They literally built it into the financial structure of the system, using this unique, multi-layered framework they call the 3Ms. Think of it like 3 layers of armor. The first layer is MediSave. This is a savings account that you have to pay into from your salary. It's your money for your routine medical stuff. And because it's your money, you're probably going to think twice before getting a procedure you don't really need. That right there puts cost consciousness into the system. Now, for the big, scary hospital bills, the second layer kicks in, MediShield Life, which is a national insurance plan. And if, after all that, you still can't pay, there's a final safety net called MediFund, a government fund. This whole structure, from individual savings to group insurance to state help, that's the engine that makes the whole thing affordable. But even the most brilliant piece of architecture is going to face a stress test. And by the 2010s, Singapore's system, well, it started to show some cracks. A perfect storm of demographic shifts and new health challenges created what people started calling pain points. The first big stressor? Demographics. Singapore is one of the fastest aging countries on the planet. By 2030, a full quarter of the population, 1 in 4 people, will be over 65. An older population just naturally needs more complex, more continuous healthcare, and that puts a ton of pressure on the system. And this chart here shows you the other big pressure. As people live longer, the kinds of diseases they get change. Now, over 80% of the health problems in Singapore are from non-communicable diseases. We're talking diabetes, cancer, heart conditions. These are chronic illnesses that need to be managed for years, sometimes decades. That's a totally different ballgame from just treating infections. So what happens when you smash those two massive trends together? Well, you get some very real problems. Public hospitals got totally overstretched. You had bed shortages, long waiting times. And for regular people, the cost of managing all these chronic conditions meant they were paying more and more out of their own pockets. These were serious pain points, and they were a clear signal that the original design, as good as it was, needed a major upgrade. And in response, Singapore didn't just, patch up the cracks. They launched a fundamental renovation of the entire system. In 2016, the Ministry of Health rolled out this really ambitious new strategy for the future, and they called it the Three Beyonds. So what is this Three Beyonds thing, really? Well, it's way more than just a catchy slogan. It's a total strategic pivot. The goal is to stop just treating people when they get sick and to start tackling the root causes that are stressing the system out in the first place. It's a whole new way of thinking about health. The first shift is beyond healthcare to health, basically moving upstream to stop people from getting sick in the first place. They do this with huge public programs like the National Steps Challenge, which literally pays people to walk more. They're also working with restaurants to make healthier food. The real challenge here, though, isn't just about policy. It's about changing culture, changing daily habits across millions of people. The second shift is beyond hospital to community. Look, hospitals are the most expensive part of any healthcare system, period. So the strategy is to move the management of chronic conditions out of the hospitals and into local clinics or even into people's homes. Now, this makes care way more sustainable, but it all depends on getting the public to trust their local GP and making sure the quality of care outside the hospital is just as good as it is inside. And the final shift is beyond quality to value. Now, this isn't about cheaping out on quality. It's about redefining what quality means. They've divided the whole country into 3 big regional clusters, and each cluster is responsible for the overall health of everyone living there. The goal is simple to say, but incredibly hard to do. Get the absolute best health outcomes for the entire population for every single dollar they spend. So our architect's journey brings us here. What we see is that Singapore's healthcare system isn't some finished, static monument. It's a living, dynamic blueprint. It's built on that solid foundation of personal responsibility, but it's one that's constantly being tweaked, redesigned, and renovated to handle whatever challenges are coming next. It's pragmatism in action. And all of this leaves us with one last really big question. This system works inside a very unique social contract, right? There's long-term political stability, incredibly high public trust in the government. So, is Singapore's model a universal blueprint that other countries can just copy and paste? Or is its amazing success something that could only have happened in its own one-of-a-kind context? That's definitely something to think about. Thanks for joining me on this explainer.